The importance of iron for the health of older adults. Iron is an essential mineral for the human body, particularly for older adults. It is not only a crucial component of hemoglobin, the red blood cell protein, but also plays a vital role in several other biochemical processes within the body. Iron deficiency can lead to a range of serious health problems, especially anemia, which affects the ability of the body to transport oxygen to organs and tissues. This can result in fatigue, reduced energy, difficulty concentrating, lower quality of life, and can lead to other serious health complications if not addressed promptly. Older adults, in particular, are more susceptible to iron deficiency compared to other age groups. As people age, the body faces a gradual decline in its basic functions, such as digestion and nutrient absorption, as well as a weakening immune system. These factors increase the risk of iron deficiency and other nutrient deficiencies. Iron deficiency in older adults can be caused by a variety of factors, including poor diet, digestive disorders, chronic diseases, or a decreased ability to absorb nutrients from food. Iron plays a crucial role in the production of hemoglobin, the protein in red blood cells that helps carry oxygen from the lungs to various organs and tissues. Without sufficient iron, the production of hemoglobin is impaired, leading to anemia. Symptoms of anemia include fatigue, pale skin, shortness of breath, dizziness, and reduced physical capacity. For older adults, anemia can make daily activities such as walking, socializing, and performing routine tasks more difficult, and it can increase the risk of falls or accidents. In addition to helping produce hemoglobin, iron also supports immune system health, energy metabolism, and helps organs and cells function efficiently. Iron is involved in maintaining the function of various enzymes in the body, contributing to the breakdown of food and energy production. Given these essential roles, it's no surprise that iron deficiency can cause many serious health problems, particularly in older adults. So, why are older adults more prone to iron deficiency? One of the main reasons is the reduced ability to absorb iron as people age. The digestive system of older adults does not function as efficiently as it did when they were younger, and their ability to absorb iron from food decreases over time. Additionally, health issues like stomach ulcers, liver disease, or kidney problems can also interfere with iron absorption, increasing the risk of deficiency. Furthermore, older adults often face nutritional challenges, such as an imbalanced diet or insufficient consumption of iron-rich foods like red meat, seafood, dark green vegetables, or legumes. This is particularly common in individuals with poor eating habits or those with difficulty chewing and swallowing food, which can make it hard to consume iron-rich foods. Chronic conditions such as heart disease, diabetes, or chronic kidney disease also contribute to the increased risk of iron deficiency in older adults. People with these conditions often experience chronic inflammation, which affects the body's ability to absorb iron and may also reduce its ability to use iron effectively. In addition, medications used to treat these conditions can interfere with iron absorption, further increasing the risk of deficiency. Another factor that affects iron levels in older adults is the weakened immune system. When the immune system is weak, the body cannot fight off infections or abnormal cell growth as effectively, which weakens overall health. This can lead to infections or prolonged bleeding, which depletes iron from the body and increases the risk of deficiency. It is important to note that while iron deficiency can significantly impact the health of older adults, this condition can be prevented and treated through a healthy diet and appropriate supplementation. Iron supplementation through food or iron supplements can help improve iron levels and prevent dangerous complications. However, iron supplementation should be done under the guidance of a doctor to avoid excessive iron intake, which can lead to unwanted side effects such as constipation, nausea, or digestive issues. Additionally, improving iron levels requires maintaining a balanced diet, incorporating other factors like vitamin C to enhance iron absorption, drinking plenty of water, and consuming fiber-rich foods. Gentle exercise can also help improve health, enhance nutrient absorption, and strengthen the body's immune system. In summary, iron is an essential nutrient in the diet of older adults, helping maintain overall health and prevent anemia. With the physiological changes and health issues associated with aging, it is crucial to supplement iron and maintain overall health. Iron supplementation and good overall health care should be part of the daily routine for older adults. Anemia and its causes in older adults. Anemia is a condition in which the body does not have enough healthy red blood cells to carry oxygen to the body's tissues. It is one of the most common blood disorders in older adults and can significantly affect their overall health, vitality, and quality of life. As people age, the body undergoes several changes that make them more vulnerable to anemia. This condition is particularly concerning in the elderly because it can worsen other health issues and lead to complications such as fatigue, weakness, and increased susceptibility to infections. Causes of anemia in older adults. Iron deficiency. The most common cause of anemia in older adults is iron deficiency. As people age, the ability of the body to absorb iron from food decreases due to a slower digestive process, which leads to lower iron intake. Furthermore, many older adults consume a diet low in iron-rich foods such as red meat, poultry, fish, and leafy green vegetables. This deficiency can lead to the development of iron deficiency anemia, where the body lacks enough iron to produce adequate hemoglobin, the oxygen-carrying protein in red blood cells. Chronic diseases. Chronic illnesses are another common cause of anemia in older adults. Conditions such as heart disease, kidney disease, diabetes, and cancer can interfere with the production of red blood cells or increase the destruction of red blood cells. For example, chronic kidney disease can lead to anemia due to the kidney's decreased ability to produce erythropoietin, a hormone that stimulates red blood cell production. Chronic inflammation associated with these diseases also impacts iron metabolism and reduces the efficiency of iron use in the body. Vitamin B12 and folate deficiency. Vitamin B12 and folate are crucial for the production of red blood cells. A deficiency in either of these vitamins can lead to a type of anemia called megaloblastic anemia, characterized by the production of large and abnormal red blood cells. Older adults are particularly susceptible to vitamin B12 and folate deficiencies due to changes in their digestive systems. A reduction in stomach acid production can impair the absorption of vitamin B12, while dietary habits often lack sufficient folate intake. Blood loss. Older adults may experience blood loss due to a variety of reasons, which can contribute to anemia. Conditions such as gastrointestinal bleeding, ulcers, hemorrhoids, and the use of certain medications like nonsteroidal anti-inflammatory drugs or blood thinners can lead to chronic blood loss, ultimately causing anemia. Additionally, women who are in their postmenopausal years may still experience occasional bleeding from the reproductive system, further contributing to anemia. Bone marrow disorders. The bone marrow is responsible for producing red blood cells, and any disorders that affect its ability to function properly can lead to anemia. For instance, aplastic anemia, a condition where the bone marrow fails to produce enough red blood cells, is more common in older adults. Other bone marrow disorders, such as myelodysplastic syndromes, can also cause the production of abnormal blood cells, resulting in anemia. Medications and treatments. Certain medications commonly used by older adults can contribute to anemia. Drugs that interfere with the production of red blood cells, such as chemotherapy for cancer, can cause a decrease in red blood cell count. Similarly, medications that cause gastrointestinal bleeding or affect the body's ability to absorb nutrients, such as certain blood thinners and anti-inflammatory drugs, can also lead to anemia. Moreover, some medications can cause hemolysis, where red blood cells are destroyed at an abnormal rate, contributing to anemia. Age-related changes. Aging itself can contribute to the development of anemia. As people age, the body's ability to produce red blood cells decreases naturally. This is known as anemia of chronic disease or anemia of aging. In this form, the body may not be able to produce enough red blood cells to meet its needs due to the gradual weakening of bone marrow function. Increased risk of infection. Older adults often have a weakened immune system, which makes them more prone to infections. Chronic or repeated infections can contribute to anemia by causing inflammation, which impairs red blood cell production. Infections such as tuberculosis, HIV, or chronic viral infections can lead to anemia due to the body's immune response. Consequences of anemia in older adults. Anemia can have a profound impact on the health of older adults. The lack of sufficient oxygen-carrying red blood cells can cause several symptoms, such as fatigue. The body is less able to get the oxygen it needs, which leads to fatigue, reduced energy, and general weakness. Dizziness and shortness of breath. Anemia can cause dizziness and difficulty breathing, especially during physical activity, as the body struggles to get enough oxygen to the tissues. Cognitive decline. Chronic anemia has been associated with cognitive impairment and memory issues in older adults. This is especially concerning as it can lead to confusion, difficulty concentrating, and decreased mental clarity. Increased risk of falls. The fatigue and weakness caused by anemia can increase the risk of falls and accidents in older adults, which can lead to serious injuries. Conclusion: anemia is a common health concern for older adults, with a variety of causes ranging from poor nutrition to chronic diseases and medications. It is essential to identify the underlying cause of anemia in older adults to provide effective treatment and prevent further health complications. Early detection, regular health checkups, and appropriate dietary interventions are key to managing anemia and improving the overall well-being of the elderly. By understanding the causes and symptoms of anemia, older adults can take proactive steps to maintain their health and quality of life. Nutritional diet for the elderly with anemia. Anemia is a condition in which the body lacks enough healthy red blood cells to carry oxygen to the tissues and organs. For the elderly, anemia can severely affect overall health, causing fatigue, weakness, and a decreased quality of life. One of the key factors in improving anemia in the elderly is a proper and balanced diet. Correct nutrition not only helps improve red blood cell count, but also supports various physiological functions of the body, aiding in faster recovery and maintaining long-term health. 1. Importance of iron in the elderly's diet. Iron is a vital mineral that helps the body produce red blood cells and is essential for the transport of oxygen by these cells to various tissues in the body. Iron deficiency is a major cause of anemia, especially iron deficiency anemia, which is quite common among the elderly. Thus, an iron-rich diet is crucial for the treatment and prevention of anemia. There are two main types of iron in food: heme iron and non-heme iron. Heme iron is found in animal products, particularly red meat, poultry, and fish. Heme iron is more easily absorbed by the body compared to non-heme iron. Non-heme iron is found in plant-based foods such as leafy greens, legumes, seeds, and whole grains. Although non-heme iron is more difficult for the body to absorb, pairing it with vitamin C-rich foods can significantly enhance its absorption. 2. Iron-rich foods for the elderly. Red meat, beef, lamb, and pork are rich sources of heme iron. However, older adults should choose lean cuts of meat to reduce the risk of cardiovascular diseases. Poultry and fish. Chicken, turkey, and fatty fish like salmon, tuna, and mackerel are excellent sources of heme iron. Leafy greens. Vegetables like spinach, kale, bok choy, and broccoli are high in non-heme iron. These are essential foods to include in a diet for improving anemia. Legumes and seeds. Lentils, black beans, chickpeas, and seeds like chia, flax, and sesame are rich in iron for those who prefer plant-based diets or cannot consume animal products. Whole grains. Foods like oats, quinoa, and brown rice are good sources of iron and help improve overall health. Fruits. Raspberries, apricots, pomegranates, and apples also contain some iron and are easy to incorporate into daily meals. 3. The role of vitamin C in supporting iron absorption. While iron is found in a variety of foods, the body may not absorb all the iron consumed. Vitamin C can enhance the absorption of non-heme iron from plant-based foods. Therefore, when consuming iron-rich foods, elderly individuals should also include foods high in vitamin C to improve iron absorption. Some vitamin C-rich foods include oranges, grapefruits, lemons, and other citrus fruits, strawberries, kiwis, and raspberries, leafy greens like spinach and kale, red bell peppers and green peppers. Additionally, drinking fresh fruit juice or adding vitamin C-rich foods during main meals will improve iron absorption in the elderly. 4. Vitamin B12 and folate. Important nutrients for the elderly. Vitamin B12 and folate are essential for the production of healthy red blood cells. Deficiency in vitamin B12 and folate can lead to macrocytic anemia, a type of anemia commonly found in the elderly. Vitamin B12. Vitamin B12 plays a crucial role in the production of red blood cells and maintaining nerve function. Older adults are more likely to be deficient in vitamin B12 due to reduced absorption as they age. Vitamin B12 is found in animal products like meat, fish, eggs, and dairy products. For elderly individuals who follow a vegetarian diet or consume limited animal products, vitamin B12 supplements or fortified foods may be needed. Folate, or vitamin B9, is also critical in the red blood cell production process. Folate-rich foods include leafy greens, legumes, whole grains, and fruits like oranges and bananas. Ensuring adequate folate intake will help prevent macrocytic anemia and improve overall health. 5. B12 and folate-rich foods for the elderly. Meat and fish. Beef, chicken, salmon, tuna, and sardines are excellent sources of vitamin B12. Dairy products. Milk, cheese, and yogurt are good sources of vitamin B12. Legumes. Lentils, peas, and black beans are rich in folate and can be incorporated into a diet to improve anemia. Leafy greens. Kale, spinach, and Swiss chard contain significant amounts of folate to help the elderly maintain proper levels of vitamin B9 in the body. 6. Maintaining healthy weight and improving digestive health. Maintaining a balanced and healthy diet not only improves anemia but also helps control weight and enhances digestive health. Older adults often experience weight loss or insufficient nutrient intake, leading to nutritional deficiencies. Therefore, fiber-rich foods such as fruits, vegetables, whole grains, and seeds are important for improving digestion, preventing constipation, and aiding the absorption of necessary nutrients. 7. Choosing healthy cooking methods. The way food is prepared is also crucial in maintaining an effective nutrition plan for elderly individuals with anemia. Healthy cooking methods like steaming, boiling, roasting, or lightly sautéing help preserve the nutrients in foods, including iron, vitamin B12, and folate. Steaming and boiling help retain more vitamins and minerals compared to frying. Roasting enhances the natural flavors of food and reduces excess fat. Light sautéing with minimal oil ensures better nutrient absorption and lowers fat intake. A balanced and appropriate diet is a key factor in treating and preventing anemia in the elderly. Iron-rich foods, along with adequate vitamin B12, folate, and vitamin C, are crucial for maintaining healthy blood and improving overall health. Additionally, maintaining a healthy diet, regular physical activity, and periodic health checkups will help elderly individuals maintain a healthier life and reduce the risks associated with anemia. By following these nutritional guidelines, elderly individuals can significantly improve their health and lead an independent and vibrant life. Interview with a doctor on nutrition for anemic seniors. To delve deeper into the dietary needs of elderly individuals suffering from anemia, we had the opportunity to interview Dr. John Nguyen, a renowned specialist in geriatric medicine. Dr. Nguyen has over 15 years of experience working with older patients, focusing on managing chronic health conditions such as anemia, cardiovascular diseases, and metabolic disorders. In this interview, he shares valuable insights on the importance of proper nutrition in managing anemia among the elderly, as well as practical dietary tips to improve iron absorption and overall well-being. Question: Dr. Nguyen, can you explain why anemia is a common concern in the elderly? Dr. Nguyen: certainly. As people age, their bodies undergo several physiological changes that can affect their ability to absorb and process nutrients. In particular, the elderly often experience a decrease in stomach acid production, which is crucial for absorbing certain vitamins and minerals like vitamin B12 and iron. Moreover, older adults are more likely to have underlying health conditions, such as chronic kidney disease, which can interfere with the production of red blood cells. Additionally, many seniors take medications that can affect nutrient absorption, and some may have reduced appetites, making it difficult to get enough nutrients from their diet. These factors, combined with aging's natural effects on the body, significantly increase the risk of developing anemia. Question: what are the key nutritional requirements for elderly individuals suffering from anemia? Dr. Nguyen, for seniors with anemia, a diet rich in specific nutrients is essential. The most important nutrient for treating anemia is iron. There are two forms of iron: heme iron, which is found in animal products, and non-heme iron, which is found in plant-based foods. Heme iron is better absorbed by the body, so it's beneficial for anemic individuals to include sources of both types of iron in their diet. Additionally, vitamins such as vitamin B12 and folate, vitamin B9, are crucial for red blood cell production. Vitamin C is also essential because it enhances the absorption of non-heme iron from plant-based foods. Therefore, a balanced diet that includes iron-rich foods, as well as B12, folate, and vitamin C, is key for improving anemia in the elderly. Question: can you elaborate on the types of iron-rich foods that should be included in an anemic senior's diet? Dr. Nguyen: certainly. For individuals with anemia, It is important to focus on both heme and non-heme iron sources. Heme iron is more easily absorbed, and the best sources are red meat like beef, lamb and pork, poultry, chicken and turkey, and seafood, especially shellfish like oysters and mussels, and fatty fish like salmon and tuna. These should be incorporated into the diet several times a week. For those who follow a vegetarian or plant-based diet, non-heme iron sources are equally important. Foods like lentils, beans, chickpeas, tofu, quinoa, and dark leafy greens like spinach, kale, and Swiss chard are excellent sources of non-heme iron. These foods should be paired with vitamin C-rich foods, such as citrus fruits, bell peppers, or strawberries, to enhance the absorption of iron. Iron-fortified cereals and breads are also helpful in boosting iron intake for seniors. Question: are there any specific foods or nutrients that may hinder iron absorption in the elderly? Dr. Nguyen: yes, there are a few foods and substances that can hinder iron absorption, and it's important to be aware of them. One of the main culprits is calcium, which competes with iron for absorption in the intestines. While calcium is essential for bone health, seniors with anemia should avoid consuming high-calcium foods, such as dairy products, at the same time as iron-rich meals. Instead, they should separate their calcium and iron-rich meals by a few hours to prevent interference. Additionally, certain drinks like coffee and tea contain tannins, which can inhibit iron absorption. While it's fine for seniors to enjoy these beverages in moderation, they should avoid drinking them immediately before or after meals containing iron-rich foods. If possible, seniors should choose drinks that help enhance iron absorption, like vitamin C-rich juices or simply water. Question: in addition to iron, what other nutrients are important for seniors with anemia? Dr. Nguyen: in addition to iron, vitamin B12 and folate are crucial for individuals with anemia, particularly those with pernicious anemia, which is caused by a vitamin B12 deficiency. B12 is essential for the formation of red blood cells, and without it, the body cannot produce enough healthy red blood cells, leading to anemia. The best sources of vitamin B12 are animal products like meat, poultry, fish, eggs, and dairy. For seniors who have difficulty absorbing B12 from food, supplements may be necessary. Folate or vitamin B9 also plays a significant role in red blood cell production. Foods rich in folate include leafy greens, legumes like beans and lentils, and citrus fruits. Folate is particularly important in preventing certain types of anemia, such as megaloblastic anemia, which is common among the elderly. Question: can supplementation help seniors with anemia? Or is a healthy diet enough? Dr. Nguyen: while a healthy diet is always the preferred approach, supplementation may be necessary for some elderly individuals, especially if their anemia is caused by deficiencies that cannot be easily corrected through diet alone. For example, if a senior has a significant vitamin B12 deficiency, a supplement or B12 injections may be required to restore normal levels. Similarly, if iron levels are extremely low, an iron supplement may be recommended, but this should always be done under the supervision of a healthcare provider, as excessive iron intake can lead to other health issues, such as gastrointestinal distress or even organ damage. That being said, supplements should never replace a balanced diet. It's essential to continue consuming iron-rich, vitamin-rich foods, along with other healthy dietary habits. Supplements are just a tool to fill gaps when dietary changes alone are not sufficient to address the deficiency. Question: are there any other lifestyle factors that seniors with anemia should be mindful of? Dr. Nguyen: absolutely. Along with proper nutrition, it's important for seniors to maintain a healthy lifestyle to support their overall well-being. Regular physical activity can help improve circulation, support red blood cell production, and enhance the body's ability to use oxygen. Gentle exercises like walking, swimming, or yoga can be very beneficial for elderly individuals suffering from anemia, as they help reduce fatigue and improve energy levels. Additionally, seniors should monitor their overall health and address any underlying medical conditions that may contribute to anemia. For example, chronic conditions like kidney disease, diabetes, or gastrointestinal issues can interfere with iron absorption or red blood cell production, so proper management of these conditions is essential. Lastly, it's crucial to have regular checkups with healthcare providers to monitor iron levels and other vital nutrients. A comprehensive health plan that includes blood tests, Dietary adjustments and lifestyle changes will help seniors manage their anemia and maintain their overall health. Conclusion: anemia is a common health issue among the elderly, and it can significantly affect their quality of life if not properly addressed. With the changes that occur in the body as we age, the ability to absorb and utilize nutrients, especially iron, vitamin B12, folic acid, and other essential vitamins, diminishes. Therefore, maintaining a proper diet and ensuring adequate intake of necessary nutrients is crucial to prevent and treat anemia. Iron-rich foods such as red meat, seafood, leafy greens, beans, and cereals should be included in daily meals. In addition, vitamin B12 and folic acid are vital in supporting red blood cell production and preventing anemia. Vitamin C also plays an important role in improving the absorption of iron from plant-based sources. Along with a balanced diet, elderly individuals should pay attention to regular physical activity to improve circulation and enhance overall health. In addition to a healthy diet, regular health checkups, particularly monitoring iron levels and other essential vitamins, will help detect anemia early and enable timely treatment. Supplementing with vitamins and minerals is only a part of the treatment process and cannot replace a well-rounded and balanced diet. Finally, it is essential for older adults to understand the importance of health care and maintaining a healthy lifestyle. This not only helps improve anemia, but also supports the enhancement of overall health and quality of life in the long term.